There are nurses earning in dollars today, not because they relocated, not because they are licensed in the United States, and not even because they left nursing. They are doing it remotely. Simply means they are doing it from comfort of their home. And no, this is not a shortcut. This is not a scam. It is real. It is a real skill-based healthcare role that many nurses do not even know that exists. Hi everyone, welcome back to my channel. My name is Ucheago, and if you're interested in immigration, nursing opportunities, working, studying abroad, then you are in the right place. Please do consider to like this video, as in this video I'm going to be explaining what a virtual medical assistant is, what they really do, who qualifies, including student nurses, courses that can help, both free courses, free and paid courses, where the jobs are, and what people do not tell you. We're gonna spill it all. What is virtual medical assistant? A virtual medical assistant, or VMA, is a remote health care support professional who works online for clinics, hospitals, private practices, and telehealth companies, mostly located in the United States. This is a non-clinical role. You are not diagnosing, you are not prescribing, and you are not replacing bedside nursing. Think of it as healthcare administration done remotely. Now, what do virtual medical assistants actually do? Virtual medical assistants handle tasks such as appointments, they handle scheduling, they handle medical documentation, they handle patient follow-up calls, insurance verification, inbox and EHR management, and prior authorization. This work supports doctors, they support healthcare teams so that patient care can run smoothly behind the scenes. Now, let me break it down in simple terms. So for appointment scheduling, this simply means that you are booking, rescheduling, or canceling patient appointments. Now, if a patient calls and says, oh, I want to see a doctor next week, the VMA, who is a virtual medical assistant, helps to find available time, available slots, and books it in the system. For medical documentation, this simply means typing or updating patient information in the computer. Let's say, for example, after a doctor sees a patient, the virtual medical assistant may help organize the notes, update charts, and make sure records are complete and accurate. You are not diagnosing, you're documenting what has already happened. So for patient follow-up calls, this simply means calling and messaging patients after their visits. For example, you can remind them about their next appointment date, let's say 24 to 72 hours prior to that appointment, depending on the company policy that you work for or work with. Now, you can check if they completed their lab test. You can give instructions already approved by the clinic. No medical advice is given. For insurance verification, this simply means checking whether a patient's insurance is active and what it covers. This is even done before a patient is seen. So the VMA will confirm if this insurance is valid, so avoid billing problems. So for inbox and EHR management, the clinics receive many messages daily, emails, patient portal messages, verification refill requests, and updates. So the VMA helps organize these messages, route them to the right person, and updates electronic medical record, electronic health record system. Now think of it as keeping the clinic's digital workspace even more organized. That is your role as a virtual medical assistant. For prior authorization, some treatments or tests need approval from insurance companies before they can happen. So the VMA helps to submit paperwork, follow up with insurance companies, and track approvals. This is based on doctor instructions, not personal judgment. So why do nurses have an advantage? This doesn't mean other healthcare professionals do not have an advantage, but nurses already understand the medical terminology, patient communication, documentation standards, and even healthcare workflow. So this is not starting from zero. It's a transition, not a career switch. That's why nurses tend to do very well in this space. Now, the question is, can student nurses do this? The answer is yes. Student nurses can work as a virtual medical assistant, but with very clear boundaries. Student nurses can handle non-clinical tasks like the scheduling, documentation support, patient coordination, and EHR data entry. Anything that involves independent clinical judgment or decision-making requires licensure, and that line should never be crossed. Transparency is very key. I've seen a student nurse write in my comment section that she's doing it. Do you need a course? Most nurses who enter the space take short courses, not because they lack knowledge, but to understand the US healthcare workflow properly, HIPAA compliance, common EHR systems like the EPIC, and all of that. A certificate alone does not get you hired. Your skills, your communication, and positioning do. So let's talk about where you can find these courses. They are free and there are low-cost learning options. So there are free platforms and there are low-cost platforms where you can start learning. For example, Coursera allows you to audit many courses for free, although certificates usually require payment. Allison, everybody knows Allison, is a free learning platform, but you need to pay for their certificates. Google Workspace, there's a training. Google Workspace training is useful for learning digital tools, even though it's not medical specific. So some free courses do not issue certificates, and that is completely normal. For paid training and certifications, there are paid options, which include the AAPC certified medical administrative assistant, virtual medical assistant. You can find courses on Udemy, Remote Clinical Academy, and Career Steps Medical Administrative Assistant Program. None of these guarantee jobs, remember, and anyone who promises you guaranteed placement should be questioned. I've also seen someone on LinkedIn offering the courses, so do search it up. Where can you find these VMA jobs? Nurses find VMA roles through general job boards such as Indeed, LinkedIn, Flex Jobs, Remote Jobs, and We Work Remotely. You can also find them on freelance platforms such as Upwork and People Per Hour. That is commonly used. So most employers care more about your skills, your communication, your reliability, and they care more of this than your physical location. How much do virtual medical assistants earn? I would say this is not an instant money. So entry-level contracts may start you modestly, especially when you're building your experience. However, if you're an experienced virtual medical assistant with long-term clients, you can earn consistently in US dollars and your pay will be higher. So it is a legitimate remote healthcare work that grows over time. Who is this part for? This part works best for nurses who are looking to work remotely. They want flexibility. They are detailed oriented. They are very comfortable with documentation. Either they want an alternative to Bedside or they are waiting to relocate. So nothing is changing. Skills are becoming very global. Geography is no longer your limit. Bedside is not the only way to earn as nurses. I'm going to answer questions below. I've seen so many videos explaining virtual medical assistant role. It's that kind of job that you can consider to do as your second job, especially if you're outside of the US. You can decide to do that on the side. If you want to relocate to the US, you need bedside experience. So let it be clear. So you can do virtual medical assistant job roles as a job on the side, especially because the time zone between the United States and where you stay is different. If you have any questions, please let me know in the comment section. Thank you so much for watching this video. The only way you can help this video is to like this video. On the comment section, drop a comment. If you're into the virtual medical assistant roles, let me know below. If you're considering it, let me also know. And sometimes YouTube will show hype on the video. Please do hype this video, and most especially consider to subscribe and join the family. And if you know any friend who you want to work together with remotely, please share this video to them. We don't gatekeep. I've been successful in life because the information that I get, I do not gatekeep. So I encourage you to please share this video to any nurse or anybody who wants to be a virtual medical assistant. Thank you again for watching. I will see you again in my next video. Bye for now.